Well, hey guys. I felt compelled to make this video today to really put the word out there. As if Oprah show doesn't already do it. But you know what? I'm a huge Oprah fan. I'm a huge Dr. Phil fan. I truly believe they make a powerful impact on us here in America. We're very, very fortunate to be able to. All the people that and the stories they bring to light is just truly, truly remarkable. But I gotta show you something here real quick, a quick clip that happened today, and I gotta tell you, this is the long, cold, hard reality of the problem with our health care. And then I'll touch on a few points and after I show you the clip. I apologize for the quality. In order to transfer it, I have to record it off of the TV. However, I want to get this out today, so here you go.
Moment came a few weeks ago during a Democratic presidential debate when retired steelworker Steve Scavara asked this year's most defining question.
After 34 years with LTV Steel, I was forced to retire because of a disability. 2 years later, LTV filed bankruptcy. I lost a third of my pension, and my family lost their health care. Every day of my life, I sit at the kitchen table across from the woman who devoted 36 years of her life to my family, and I can't afford to pay for her health care. What's wrong with America, and what will you do to change it?
Okay, so I'm continuing to watch this Oprah show, and I'm getting even more disturbed than I already am. And I got another clip I want you to see, and we really need to get the message here. This is wow. This is an eye-opening episode here, and so I just feel compelled to say, that we need to make a difference. Nobody else is going to do that for us. Now, I happen to be involved with Market America, and we deal in nutraceuticals. Now, let me rest assured, I'm not doing this as any kind of a sales gimmick, but we need to realize that nutraceuticals are, the benefits far outweigh the pharmaceutical industry, and when you have pharmaceuticals that are synthetic, and yeah, they work for people, and and they keep moving from this drug to that drug until they find something that works for that individual, that's fine. They tend to mask the problem as opposed to getting to the core of the problem. It's almost as if we need to make a change for ourselves, and knowing what our bodies can or cannot handle, as opposed to leaving it up to the government, if you will. So anyway, let me show you this clip, and then we'll talk some more. Hang on.
There's a very powerful moment, one very powerful moment in Micheal Moore's film SICKO was watching a brave doctor's candid confession before Congress. Take a look.
My name is Linda Pino. I am here primarily today to make a public confession. In the spring of 1987, as a physician, I denied a man a necessary operation that would have saved his life and thus cost his death. No person and no group has held me accountable for this, because in fact what I did was I saved a company $500,000 for this. And furthermore, this particular act secured my reputation as a good medical director, and it ensured my continued advancement in the healthcare field. I went from making a few $100s a week as a medical reviewer to an escalating six-figure income as a physician executive. In all my work, I had one primary duty, and that was to use my medical expertise for the financial benefit of the organization for which I worked. And I was told repeatedly that I was not denying care, I was simply denying payment. I know how managed care maims and kills patients, and I'm haunted by the thousands of pieces of paper in which I have written that deadly word, denied. Thank you.
Well, hi there, I'm back. Just finishing up this video, just want to put some finishing last words on it. Don't want to leave you hanging. So here's the bottom line. For those that just didn't get a chance to see it, see the show, I hope the messages gets across. If you get a chance to see it, it was Oprah's show from the 27th, which was yesterday. Today's the 28th, and I just got a chance to see it today. Then also to see Micheal Moore's movie SICKO. She highly recommends it, so I'm going to go out and get that as well. So I mean, you know, here's the thing: it's just know there's alternatives. You know, we as individuals need to take preventive measures before we even get to the point where we're sick. Now, it's not always doable. Okay. However, I you know, I have a whole book full of nothing but personal testimonials from people that we've dealt with in Market America here that just have had absolutely phenomenal results. And I can't get into the logistics of that for legal reasons, but just know that people are just getting phenomenal results. When you have people, you know, who experienced, pains and aches for years, and now all that seems to be subsiding due to, Pignogenol is huge. It's been all over the news. The acai has been all over the news. Pomegranate has been all over the news. We have liquid aloe with helps with the digestive system. I mean, OPC3 is our highest selling antioxidant, and it has helped substantially with people who, between aches and pains, and it helps against the free radicals and helps keep things going. And it's in it, and a lot of our products are in an isotonic format. And you'd have to visit my website to learn more about it, and I can send you to another website that gives you the science behind it. So, again, I am simply sharing this as something that as an alternative. What anybody does from there is definitely, it's the beauty of America. We have choices. But all I can do is share that information with you, and what you do with it from there is totally up to you. But I hope, if I can make a difference in at least one life out there, then I've done my job, because that's really what this business is all about. And so, anyway, with that being said, I truly appreciate you taking the time to listen, and have a great night, and or day, depending on when you watch this video. And you take care, and I'll be talking to you soon. Bye for now.